Hi, I'm Dr. Robert Alfonso at Lakeway Center for Cosmetic and Family Dentistry, and I'd like to talk with you a little bit about implant dentistry. This is a way of replacing teeth with dental implants. Dental implants are a way of replacing teeth without having to use something that goes in and out of your mouth like a traditional denture or partial denture, or having to prep on adjacent teeth with what's called a bridge. The simplest type of implant dentistry is when you just have to replace one tooth. There's a couple of ways of replacing a single tooth with an implant. Essentially, with a one-phase surgery, you simply place the implant into the bone with a healing abutment. This abutment communicates with the oral cavity, and after 3 to 4 months, you can simply take off that abutment, place an impression post, and fabricate your abutment and crown. Replacing a single tooth with a two-phase surgery is a little bit more complicated, and it's usually involved when a tooth has to be extracted and then immediately replaced with an implant. Typically, you don't place a healing abutment, you place what's called a healing screw. That way you can cover over the implant with graft material so that it can integrate intimately into the bone and not have the oral cavity contaminate or disturb the implant. Again, after about 3, 4, sometimes 5 or 6 months, the healing abutment is placed so that you have communication with the oral cavity and the implant. The healing screw is removed. After that, you wait about 2 weeks or so for the gum to heal around the healing abutment, and then you take the impression for the final abutment and crown. Another way of replacing implants, if you're missing a tooth that's going to be in a more cosmetic area, is with placing an immediate temporary. Typically, if you're replacing a molar, you can place a healing abutment or a healing screw and not worry about replacing the tooth with a temporary. But with a front tooth, especially an upper front tooth, that's not going to be acceptable. So when you place the implant, if you can get enough torque, typically about 35 Newton centimeters, how we measure the torque, you can place what's called a healing or a temporary abutment and a temporary crown. Make certain that that temporary is not loaded, there's no pressure with the bite, but the patient is then able to at least smile and function with a temporary in place while the implant is integrating into the bone over 3 or 4 months. If you're replacing an entire arch of teeth, you have a couple options. One, you can place implants and you can load those implants immediately with what's called a hybrid denture, and that denture is never removed except by the dentist in the dental office. Or you can replace the teeth with what's called a removable implant supported denture, in which case it's essentially like a denture, but it snaps down onto implants. What we have here in our office is a CT scanner. It's a cone beam computerized tomography that is used to visualize the bone three-dimensionally. This way we know which type of bone is adequate for supporting the type of implant that we want. If we know that we're going to be able to have enough density within that bone to load the implant immediately, or if we need to prepare patients for using something removable while the implant's integrating. It also allows us to see vital structures that are around that we want to avoid, such as the maxillary sinus on the upper arch or the inferior alveolar nerve on the lower arch. You don't want to damage either of these structures, and you want to make sure you have adequate bone to support the appropriate implant. In some cases, grafting needs to occur, usually with a specialist, in order to accommodate the appropriate implant type. Dental implants are quickly becoming the standard of care. Sometimes there's teeth that we try to save with root canals and crowns, and if there's any question as to the prognosis of it, sometimes it's advisable for patients to just replace the tooth with an implant. So oftentimes we will choose to replace a tooth with an implant rather than do a guarded prognosis with trying to save the tooth with a questionable root canal or crown. The success rate with implants right now is well over 95%. And the nice thing with implants is you can never get a cavity on it because it's titanium and a porcelain, some form of porcelain crown. There can become gum disease around it. You can get what's called peri-implantitis. So care still needs to be taken with professional cleanings and home care to be certain that oral hygiene is adequate. I hope this information has been useful. If you have any other questions regarding dental implants, feel free to visit our website, lakewaykosmeticdentistry.com, or call our office, and we'd love to see you here for a complimentary consultation. to see if implants are a good fit for you.